Let's talk about how I adjust a C1 misalignment. I've been a chiropractor for almost 2 decades, and half of that time I have been treating C1 misalignments. I've treated hundreds of patients and done thousands of C1 adjustments. So I'm going to give you my opinion on C1 alignment and how I correct it. So there's about 7 details we have to cover to fully understand a correction. So the very first one we're going to talk about is why adjust C1. We adjust C1 because of one very important thing, and that is nerves. These structures right here, C1 vertebra right here, and of course that is the intention of doing C1 adjustments. So the second detail that we need to cover is going to be how does it affect the nerves? Well, the C1, as we can see here with its close proximity, if the C1 deviates, it is going to negatively influence those nerves. And if that C1 very small translates and it goes forward, it is going to encroach on that space. My opinion is that, and this is what I correct, the C1 can deviate into multiple places, but most of the time there is a forward or anterior translation which causes encroachment or some irritation on these nerves. Of course, I will show you on a different model here. The C1, as we can see up here, this vertebrae here, okay, the C1, because of its mobility of C1 on C2, it does have the ability to translate in small degrees going forward. Now, if we see a slight rotation, or if we see a slight deviation, that's fair. But in my opinion, what I've experienced is it always goes hand in hand with a slight anterior deviation, which is what causes the impairments on the nerve structures. So now we know what is happening to the C1, and then comes to the third detail: how do I correct a C1 misalignment? So what we want to do is we want to reset, restore, and realign. So how do we do that? If there is that deviation, what we want to do is reset that position to restore where that C1 needs to be and ultimately realign that position. So what I do is I do gentle mobilizations using a manual leveraging of the head to draw that C1 back into alignment. So if it is deviated, we will use the procedure, okay, the manual procedure using my hands, leveraging the head to drive that C1 on both sides back into position and letting it reset to where it needs to be, taking pressure off those nerves. So if we look back at this model, you can see that if I drive this bone back, it will take and relieve pressure off those nerves. Like I said, it is a gentle maneuver that I do. It is what we term immobilization, so it is not one little press. We will be leveraging and mobilizing and moving this, and the nice thing is that the head is always in neutral, so there's no twisting and no rapid force or crack type maneuvers. So the next question is, with adjusting this, is there any risk? We are not twisting, thrusting, doing anything of that type of adjustment. The only risk really that ever comes into play when we are adjusting a C1 is what I term the buzz. So what is the buzz? Well, if you've ever sat on the toilet and your foot has fallen asleep and all of a sudden you're feeling cold in the foot, but you take pressure off the nerve when you get up and it buzzes harder, or you get the pins and needles. That's what I term the buzz. That is a temporary amplification of a nerve-related discomfort, and that is only temporary most of the time, but that is really the only consequence we see with taking pressure off nerve structures. So could it irritate a headache temporarily or any symptoms? That's always the possibility. It's uncommon, but it does happen sometimes. The next thing we have to cover is, are all C1 adjustments created equal? It's not that one is better than another. I never want to give that impression, but they are different. And how are they different? That is because for me, the vector, or the direction at which I'm adjusting and restoring the C1 is front to back. Other styles come in from the side. And that's okay, we're all just trying to get the same outcome, but this is what I do in terms of the style that I practice and that I teach. The other thing besides the direction at which we adjust is the force. Not that I use too much intensity, but I do use a fair bit of force to truly reset and reposition what is going on with that C1 vertebra. The next thing we got to talk about is why traditional adjustments don't correct C1 alignment. So if we talk about a traditional adjustment, which is the thrust, and the one where we do achieve a pop, and that is usually because it is going in the same direction as the C1 misalignment. We are pushing forward, where, as I said, which is in my opinion of all the work that I've done, the C1, when it is misaligned, has a degree of forward or anterior translation. We have to drive that back, not accentuate that forward. And so in my opinion, that is why traditional adjustments don't work, because it is not in the best direction. The last thing we have to cover is, can you self-mobilize? Can you restore this alignment to some degree on your own? And the answer is yes. But that's in the future in another video. Thanks for joining.